career, my list of injuries is actually not that substantial. You know, like just your normal everyday stuff, which is pretty surprising for the level that I competed. I never had any fractures, broken bones, no season career-ending injuries, and no surgeries. That's partly due to me being durable, but also probably the basis of everything that I've learned and the way that I learned gymnastics also plays a big factor, because there's plenty of times I could have hurt myself really bad, just didn't happen that way. So now I'm a physical therapist. I graduated PT school in 2012. I worked at ATI Physical Therapy for about 4.5 years. It was attached to Legacy Elite, so I got to see a lot of the girl gymnasts from there. My goal when I started this, career is to always branch off to myself, if and when available. I wanted to get the numbers in, wanted to see the patients first. And so now currently I'm in just finished my second year of having my own physical therapy business. I'm outside of Gymkhana, but I also work with some of the Lakeshore boys too. And I've been doing that for 2 years, so I've got to treat pretty much like 80% gymnastics population, which is awesome. It's what I want to do, it's what I want to see, it's what I feel like I specialize in. And so after this past couple of years, I've gotten a lot of good experience, got a lot of better techniques to kind of work with people. I get to spend a full hour with my patients. If you know anything about physical therapy, usually you get 20, maybe 30 minutes with someone, they pass you off. I mean, with me, I work with them from the beginning to getting them fully back to gymnastics, because I'll just take them out to the gym and say, all right, well, it hurt doing this. Let's see what your round back handspring looks like. Well, it's not right. This is why it hurts. Or your layouts, your set's bad. If it's on bars, your kick or tap, whatever it is, we can correct it so that I can say, yes, you can go in and start doing that now, versus saying, yeah, I mean, you should be able to. And if they have the strength and the motion, if their mechanics are off, it doesn't matter. They're going to come back to me anyways. So, some key points that I pretty much found with every single gymnast that I see is one of these things are off or wrong. And there's only 3. So, a correct hollow hold. So, can they do it correctly? Do they have the strength to apply that to gymnastics? A proper arch, so not just bending in their back, but how are they doing it? Is it tight? Are they squeezing their butt? Are they using their thoracic spine? Or are they only hinging in their lumbar spine, which we'll talk about more? And then the last one is like overhead strength. I wasn't sure if I was seeing more girl gymnastics coaches or guy gymnastic coaches, but for girls gymnastics, they have like a very, very high rate of, it's called OCD, osteochondritis dissecans, of their elbow. It's not the big bone not the pointy end, it's this like small humeral head on your thumb side that attaches. And what happens is the blood supply to that bone, for whatever reason, under stress, they don't know, dies, or it doesn't supply blood supply anymore to that area. And so if you don't have a blood supply, then it doesn't heal. And if you keep loading it, it fractures, it disintegrates, they have to go in and do surgery. So why does that happen more with girls than guys? I think it's because, at least for guys, we have to do rings, we have to do P-bars, we have to do horse, we have to do all these other apparatuses that require us to build our strength up. For girls, they don't really have that. I mean, they have bars, and you're just swinging around. I mean, you gotta be able to do a press handstand, right? And then everything else is pretty high impact. They have beam, which is not giving. They have floor where they're tumbling, and then they have vault where they're all doing their chankos, and they're having all these huge forces going through their elbow, and they can't stabilize either at their shoulder or their spine. So this is happening every time. So why do you think that their elbow is becoming an issue? So with overhead strengthening, I think that that's key. It can obviously help with guys as well. But the other main thing is all the exercises that I'll kind of show you. There'll be a lot of different progressions, so it doesn't matter if they're just starting out as gymnasts or if they've been doing gymnastics for 15 years. You can do these exercises with everybody, and that's kind of the thing that you're going to want to look for when you're thinking of exercises. You can't be like, well, you're really good, so you should do this one. You're not very good, so you have to do this totally different exercise. They should be like, all right, this turns into that, okay? So your goal is to get there, and when you can do that, then you're strong enough. And then that basically ends up being a full body exercise. So you're not doing crunches. We're not doing just bicep curls. We're not just focusing on simple pressing. We're not isolating different muscle groups. We're going to end up doing it as a full body closed chain exercise because that's functional for gymnastics. If you ask them, you're throwing your head out on your tap for your dismount, and then you realize they're throwing their head out because they can't scoop to a hollow position, so that's the only way they can get there, then telling them that they're throwing their head out doesn't change anything. If their feet are coming apart on their backswing and you tell them to get on the stomach and heel drive for you and their feet come apart and they're bent or not looking good, that's not like, they should be able to do it on the ground first. If they're doing gymnastics and it's coming apart, that's not the problem. You have to go back and give them easier stuff to reinforce what you want and what they should be doing. So, the last thing that I kind of want to talk about is rate of perceived exertion. So, basically, whatever exercise it is for that gymnast or patient, it needs to be pretty difficult, right? Now, it doesn't mean the exercise has to be difficult. It could be easy for me, but if I see someone struggling with a basic exercise, then that's a good exercise for them. It doesn't matter. It doesn't matter that I think it's easy. It matters what their body is responding to and if they can do it. So, base that off of what it looks like they're doing. If you make sure that they're in the right position and it looks hard, and you're like, man, that should not be hard for you, then that's where they're at, and that's where they have to stay at, and then that's where they'll progress from. Some of the things I see, is we're gonna do 2-minute handstands, or we're gonna do, 5-minute planks, and I just don't see that translating to gymnastics. You don't do anything for 5 minutes. If their core is strong enough to do a long duration, low hold, that's no good. It's like a marathon runner then trying to get into sprinting. It doesn't make sense to me. So if there's only 8, do you guys have 8 to 10 skills still? Is it 8? 6 to 8, so even 6 to 8. So when you're thinking of exercises for them to do, that's the range you want. Is they should only be able to do 6 to 8 maybe of that exercise before they start losing form. Because that's what you're expecting out of them for gymnastics. They don't need to do it 20 times, because that's probably too easy, or they're cheating. And if they're cheating, they're learning the wrong movement. So then when you tell them, okay, I want your head in, they're not doing it because they only learn how to do it wrong because you gave them too much of something. And then once the athlete can do it easy, then they move up to the next progression. It doesn't stop with that. So correct hollow hold, pretty basic. Make sure the low back is flat. That's the easiest way. So you have them lay on the ground. Let's see if it's set up over here. So I just happen to kind of have some of these. But, all right, so this right here, if I take my hand, I try to shove it right below my lumbar spine, and you should not be able to budge. There should be no space, no gap, nothing. If you can even get a little finger even halfway to the spine, they're still doing it wrong. It has to be flat. They have to be pushing your hand out. And that's all you start with is a hollow hold. Now with my arms above my head, that's technically harder. You might need to start with their hands below to their side, and then the progression of that is even just straight out in front, up and down, and then eventually it's overhead. The other thing I see a lot with hollow holds is that they're going to be flexing their chin up a ton. You want their head not out, but more neutral. So not out, not in, but neutral. It's a chin tuck, and that actually ends up working your deep neck flexors, which is literally the core for your neck. So if you're seeing people cheat by by lifting their head. If you're seeing people cheat by doing like a swimmer technique to where their hands are holding their head up, that's not good, because then when their head comes out when they're doing stuff, it literally could be because they can't stabilize in their neck because they've been cheating that exercise. Yeah, so start with the arms aside, progress to make it harder. You can also, depending who walks in the door, yes. Oh, okay. Depending who walks in the door, they might not be able to straighten their legs all the way. So their knees might have to be slightly bent. And is that bad? Well, it means they're not strong enough, but that's where they have to start. So that kind of goes back to being able to make it easy enough to where anyone can do it. So yeah, anyone can do it, but what do we want to see? Well, eventually we want to see them, you know, and this is going back to, all right, I don't care about a 60-second hold. Most of the gymnasts that I end up seeing are, you know, club. Some of them are really good, and they'll do a 10-second hold properly and be tired. You know, these kids are kids that are elites, and they still can't do this correctly. Because, and I'm thinking in my head, like, but you guys do minute holds all the time. So that all that tells me is that when they're doing a minute hold, they're holding for a minute. They're not holding to get stronger in the core necessarily. So you can start at 10 seconds. You can bump it up to 20 or 30 seconds, that's fine. But I would say longer than a minute, or even up to a minute, is a little pointless. I'd rather make it harder by rocking than hold for a minute. So that's the next progression, is to rock. Because when you're rocking, now you're putting forces through your hands and your feet, which is much like gymnastics. If you're on the bar, if you're kicking and towing, that's what you want. You want that compressional force. You want them to be able to fight those G's, not just hold it in a static plane. So, let's see what we got here. So yeah, can't get under, you have the rock, trying to keep the arms above the head, staying nice and tight, chin isn't too flexed, head isn't out. You can make a bigger rock, obviously. Feet are never touching. You want to see them like a boat, like a banana, and that's pretty it. I mean, that's it. These are things I don't want to see. Hands coming down, back piking up, feet dropping down. Those aren't good body positions. That's just another view. All right, and then, other than that, for a hollow hold, the next progression is full body. So, one of my favorites is actually plank to failure. I think I have it on here. Here. This one, I like this one. Once they get that, I like this. It helps for towing. It works the obliques. It's really hard. Hollow rock 360s. I'll go one way. I'll go the other way without stopping. You got pretty good core straight. Most people probably won't be able to do this without piking, without their feet touching, without not being able to keep their hands above their head. So if they're doing blind changes and they're arching, their feet are coming out, this will help them at least get the concept of towing over. This one is plank to failure. I like this one a lot because, once again, anyone can do this one. It's just how intense, how far down do they go. So you count to 10. So every time you count, you slide out 1. Hold for like a second. Slide out 2. Slide out 3. Slide out 4. You go to 10. On 10, your rate of perceived exertion is at max. You are working as hard as you can to maintain that position, and you can only hold it for a second or two because you're working as hard as you can. That's the point. So this is a forward view. I think I'll also have a side view. 5, 6, I don't even know if I'm counting on the number right, but you try to get as low as you can. Now, if the back cannot arch, you want to get as low as you can, and that's the goal. This is a side view of it, same thing. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, hold, and fall. So once again, anyone can kind of do that. They won't be as low as that, that's fine. The slides might be much smaller, but anyone can get to 10 and work as hard as they can. So that's the whole point. You want to be super low. Perfect. So proper arch and heel drive. So the opposite position. For the most basic, literally you get them on their stomach, and you have them do a press up, slash it, kind of like a seal stretch. However, what I do is I have them only press up as high as they can without bending in their lumbar spine. So they don't get up very high, but what they end up doing is opening up that chest, and they start getting a nice curvature in the low back. Once again, so this is like super basic, like why would I ever do this? Who would need it? Sometimes anyone with back pain from doing extension-based stuff. So I had a guy, I see him every 2 weeks. Once again, he's like a really good gymnast. He started having more frequent back pain. He never really had it before. And so, I was like working on his muscles because they were tight. And then after like the third time, I'm like, you know what? Like, you shouldn't be having this. So I looked at it further. I literally had him do this exercise. As in, at first, I just told him to press up. So he pressed up, hinged everything in his low back, his thoracic spine completely straight. I'm like, okay, well, I want to see you just press up in your chest. That's it. Just arch as much in the chest. I put my hand on his low back so he can't bend. So I'm like, so if he comes up, he hits my hand in his low back. So he works on going as high as he can. I stop him, I have him repeat it. Then I had him do the press up with it, no back pain, because now he's opening up in his chest. Because the lumbar spine is the most it's meant for mobility. So it's gonna bend. And that's part of the reason why everyone gets back pain with gymnastics is when you're loose, your thoracic spine is naturally very tight and stable. So we want our thoracic spine moving while stabilizing our lumbar spine, right? That's why we do all these core exercises. However, whenever we start extending, we just let them bend in their low back. So it doesn't matter how strong your core is, because your core is not doing anything when you bend backwards, right? So teaching them to bend in their thoracic spine is huge. And literally, the next week I saw him, he had no back pain. Good. That's not really groundbreaking movements, but that basically was the main driver for his pain. Now, it's not for everyone, but I'm just saying, it seems stupid sometimes, but it can work. The next is, just arch up, hold. So on their stomach, arching up, squeezing tight, cues you're wanting to do, feet together, because obviously whenever they're doing swings, you want their feet together because it's a deduction. You want them squeezing their butt, and that's probably the biggest cue. If your butt is squeezed, it's really hard. I think it might be impossible to be loose in your back. So when they're doing that, they're not worrying about arching up. They're worrying about squeezing their glutes and squeezing their feet together. Then you can add arms overhead if you like, but you don't have to start there. They can start here because you want to focus on the different segments. If they're not giving you what you want to see, then you dumb it down. You make it easier. But once they got it, you have to make it harder. Once again, you can do 10 seconds. You can add rocks. You probably don't need a minute of it, right? Yeah, so you add rocks. As they're rocking, they're heel driving. And then as they're rocking the other way, they're actually raising up in their chest and shoulders. Try to do more than arm reach. Alright, so this one, the press up, slow downs, they're, oh, we're good. Alright, this is really good for anyone with back pain. So what I'll end up doing, you have to have someone sit on their feet or have them put their feet under a hard mat so that they don't come up. They do the press up. And then what they'll do is they'll raise their hands up, try to maintain that position, and come down slowly. Probably a count of 4 or 5. So it's basically eccentric. That works really well. I mean, it's just good rehab for anybody. You guys can try it yourself. But that is one of the typical ones I do with back pain, definitely with like a spondy in their back, because if they can do that, then their spondy is not bad. As in like, they should not have back pain from a spondy if they can do that, because it adds a lot of compression and you're already in an arch position. The other one is Swiss ball heel drives. I like this for maybe more handspring stuff. If you have a vaulter who does handspring, like pikes or fronts and stuff like that, and they get really loose in their back. They have a Swiss ball here, hands go down. What they do is they'll heel drive, squeeze their butt. You're not worried about how much arch there is. It's all right for their arms to bend. As they're up, then they come down nice and slow, so you get that eccentric. And they work through a range that's a nice tight arch. I would say tight arch, it's no bend in the low back. If you're seeing an hinge in the back, then they're doing it wrong. You don't want to see that in gymnastics. It doesn't look good, and it doesn't function well either. And then, I mean, you can always just do, heel drives off the ball. You've seen those. But the main thing is this: if you guys do the heel drives, the eccentric part is more important than even the drive for building muscle and strength. I also added this one. I like this. It could be off the vault or a mat. Someone else will have to sit on the legs. And they start all the way down, and then they just go up to neutral. So you want them to go up to completely flat. One reason why is because when they do that, you might realize they have no idea where straight is. They might be higher, they might be lower, they might be straight, but now their back is arched, and you want to see straight. Not arched, but just from flexion to straight. I'll have them do 10, repeat. Then, from that neutral, I'll have them work up 10. Then I'll have them do full range 10. So I like it, it's segmental. It kind of works on both ends of the heel drive, or of arching. And with 30 of them, it's pretty tiring. The other thing, probably focusing on back handspring type drills. I was thinking maybe for more high school gymnasts. Gymnastics has a lot of unnatural positions. As in, if you're doing a backflip, you're going to want to throw your head because you want to see where you're going. But in actuality, it's not what you want to do. You want to swing your arms upright, you want to raise, you want to wait, you want to set. So you have to, for back handspring, same thing. You're going to want to throw your head the first time you're doing them. So working on these, just drills onto a mat where they're hitting a nice tight arch. The other thing with like a back handspring that I see a ton, especially more with girls, because they do their back handsprings like their back walkovers. As in, they'll undercut their hands and really big arch position and impacting on top of it. And the back handsprings just travel. Back handsprings is basically a whip back without hands, or with hands, right? Whip back and back handsprings are synonymous. So they should travel. A back walkover is just a completely different monster in itself. So to do the back handspring, I spent a lot of time teaching them that they don't really need to rotate. You probably need to rotate a quarter of a flip before your hands hit. I'll kind of demonstrate with my hands, I guess. But the whole point is for the back handspring, if I were to catch straight up and down all my force, that's similar to someone picking me up by my feet and dropping me onto my hands. That's a lot of impact, right? So ideally what you want is you want to spread that out through a bigger time. As in, like when you walk, you don't just hit your toe every time, right? Hit your heel, hit your midfoot, and then you toe off. It kind of distributes that force. Same for the back handspring. So if you get your hands on here, and your feet are back here, then the force dissipates for a long period of time. It means there's less force on your spine and your whole body. You don't even have to be as strong. So, working on proper, just tight positions. It's almost like you just wait. You wait for the ground. You got to stay tight. You have to know how to stay tight, and that's kind of the whole point of a proper arch. Is knowing what position you want to be in to stay tight. And finally, overhead strength and shoulder strength. So, I guess for a handstand, one of the other things I'll do too, to make it real basic, so we can start way back, you can have them sit down with a mat behind them, keep their back flat, get like 5, 8, 10 pounds, each hand, whatever dumbbells, and have them work on a seated, pretty much a handstand position. You're going to be opening up in their shoulders, you're going to be pressing up, and their eyes will be on their hands, but not their head. And then they hold it, right? They can also do it in a handstand, but this is basically the stuff that you want to be in. For a handstand, you don't want to be compensating low back because you don't have enough shoulder mobility, but that's simple. That's one that anyone can work on, anyone can do. So yeah, there it is, seated weight, overhead, back is flat against mat, that's basic. One of my favorites, instead of doing just handstands against the wall, is a tucked handstand. So basically, you'll have them go to the wall, hands will be a little further than normal, and then they're gonna slide their feet down into a completely tucked position, because what that does is it takes out the lumbar spine. They can't arch down. The other thing it does, it puts all the force on their shoulders to hold the handstand instead of their wrists. So basically, you're making this handstand a lot harder. So if that's what you're working on, that's what you do. Now, that wouldn't be easy for someone who walks in the gym. So how do you do that? Well, it's kind of easy. You end up taking a mat, letting their knees be on the mat in a tucked position with their hands down, and now they're working with 50% body weight. But their goal is to get to the wall. Once that gets easy, then you can add weight shifts to one arm. If you're working on pirouettes, if you're working on, I guess anything, even blind changes, looking down the arm, stutzes, handstand tuck, shift weight, push down. Position, eyes up. Shift weight while you're still in that tuck position. It's pretty hard. And then if they're really strong, then they can actually do handstand push-ups in the tuck position. A little awkward with your feet sliding, but it's not easy. It's definitely harder than just a normal handstand push-up. And then other things that you guys can always work on. So handstand walks, I think planche holds are great for pressing and that type of stuff. Starting tucked, obviously, working your way up. And then for handstand versatile falls, that one is for the core strength. When they go handstand, I'll have them, go more in a plank position. Someone's holding their feet. That's for core in that last section. For this section, I think of it more as overhead, but it could even be more extension. They'll be straight handstand. You have them fall the other way. You're obviously not going to fall as much. One thing I like to do too is make sure their hands are turned outward, so that, because if they're normal handstand, wrists don't really bend that far, and then they're going to be complaining of wrist pain. So just hands out, they come back, try to maintain a straight position, and all they're really going to be feeling is opening their shoulders and activating basically their rhomboids, anything between your scapular shoulder blades. And it's still all positioning stuff. It's strengthening, but it's really working on positioning. This was maybe more for girls gymnastics, but for more shoulder strengthening. I mean, P-bar walks, great. Just maintaining a nice tight hollow position. Now your core is engaged. You can go up, down. You can even elevate the P-bars if it's too easy. Ring hold, so just even jumping and holding a proper position on the rings. Once again, this was maybe more for girls gymnastics because most of them have rings, and if they're weak in the shoulders, I don't think any girl can even support themselves on rings correctly. So that would be very good, very difficult. Handstand holds on rings, just another progression to make a handstand stronger. I don't know why a girl would need to do that, but if you're trying to get stronger shoulders, that might be something to push them if they have a decent handstand, but you still don't think they're where they need to be. But main thing is get creative. So, there's no one way to do this right. So I gave you some examples, but those aren't the only ways to do it. You guys might even have some things that you do that already incorporate all this. So it's all good stuff. Much like a diet, there's really no one way to do it, but they all kind of follow the same premise. And, use your own experiences and your personal beliefs. So, you want to use weights. Are weights good for people? Is weightlifting good? Weight training? I'm not going to tell you it's good or bad. I think it can be good, but I think it could also be bad. It depends on how you use it, right? So if that's something that you are into, that you like doing, maybe add some of these things that, you know, maybe you only do 6 to 8 times, because lifting 6 to 8 times because that's how many skills are in their routine, stuff like that. Trying to play with those numbers and rate of perceived exertion. And yeah, make sure whatever it is you do translates to gymnastics. So whether it's reps, sets, time, or difficulty. If you're doing anything for 5 minutes, it's probably just more general conditioning, which is fine, right? Some people are just out of shape. But just know that that's not necessarily going to make them a better gymnast right then and there. But if you want to just give them a good workout, sure. But then again, they're probably in the gym for 2 or 3 hours, so they should be getting a good workout. Make sure that, you know, difficulty is appropriate. Make sure it's not too easy. Make sure it's not too difficult. Find something in between, but have an idea of what, you know, you're going to have multiple different levels, but they should all be able to do the same type of exercises. And last thing is, you know, gymnastic strength comes from their tendon and bone strength, not necessarily their muscles. So we're not really even trying to put on muscle as much as probably building tendon strength and bone strength within these gymnasts. That's going to get them better. Usually the muscle, if the muscles get too big, too fast, then they either lose flexibility or they're going to get some tendinitis, which is because their tendon's not strong enough. The muscles can grow, the muscles can get strong. Problem is if you get too strong too fast, then you can run into overuse injury. And the last point is consistency. So whatever you guys decide to add, you got to be consistent with it. You can't add this stuff just for a month. You can't do this stuff just once a month. It won't fix, it won't work. So find something that you could add with your gymnast that you believe in, you know, 2 to 3 times a week. It's perfect. You don't have to do it every day. You guys can split it up to where they're doing stuff every day, but they're not doing the same stuff every day. You know, it takes years to load tendon and bones to get strength. So I do Ninja Warrior now, and I started rock climbing. It probably took me 3 to 4 years of rock climbing to actually get my tendon strength to where it needed to be. It just took time. You know, it took being consistent. I would go rock climbing, you know, maybe 2 to 3 times a week. That's it. Maybe only spent 30 minutes, 20 minutes, not a lot, but that consistency got me stronger. And if I wasn't consistent with it, you wouldn't see gains. So whatever you guys add, I mean, trust that it works, because it does. You know, and for your gymnasts, they're not very flashy exercises. I mean, nothing really has to be, but they may not be applying themselves 100% to these things, but if you basically convince them that if you can do this movement, then you will get this skill, that kind of gets them more motivated. That will get them excited. That's why you're having them do it, right? If it wouldn't make them a better gymnast, why would you give it to them? So as long as they know that you're just not giving them stuff to make them work hard or just be sore, like you're actually giving them stuff because they can't make this skill because they don't have the strength yet, this is what they need to work on. And yeah, my final thought. Doesn't matter who you are, everyone's always at risk of injury. Like we can all walk out of this room and we're all at risk of twisting our ankle, right? Doesn't matter how much rehab, whatever you do. But some people are at much higher risk because of their weakness, because of their movement disorder, we'll call it. So we want to decrease that. I mean, there's no way to say if you do this, you won't ever get injured. But you'll get injured a whole lot less. You're a whole lot less likely to get injured if you're doing this stuff or if you can do this exercise. All right, so any questions? Yeah.
So a lot of our guys run into shin splints and forearm splint issues. Do you have any prevention or rehab strategies?
Yeah, so typically that type of stuff, is that mostly, it doesn't matter how long they've been doing gymnastics, or is it mostly the all over? Yeah. So I think as a coach, one thing you might want to do is intertwine maybe something on a softer surface, whether it's more like a tumble track or softer landings within as you're increasing their load, because basically it's an overload issue. Maybe they weigh too much because they're getting back into shape. Maybe they're just beefier guys. you know, because they just have a ton of muscle and it's just more force than their body's used to. But the other prehab thing you guys can always do for those types of things is soft tissue work. Because what happens with both of those issues is the muscles are too tight and they're pulling from the bone. So they're getting kind of like a bone pain, but it's from the muscle. So if you could even just say, all right, for 5 minutes before every workout, you guys are gonna roll out your shins and cast. It also depends on where it is. Typically shin splints is in the front, but there's also posterior shin splints, which is kind of on the inside back. And that one is more or less because of instability of the flat feet, I guess you can call it. I mean, what are you gonna, and I always tell my gymnasts, it's like, well, what are you gonna do, wear an orthotic? No, you're barefoot, you know? So there's not a ton you can do for that, but you can get in there. And that one's a little bit tougher to get with, I mean, you can't even get it with a foam roll. You probably need a tool, you need your thumbs to really dig in and get there. But foam rolling the front of the shins is easy enough. They also have something called an arm aid. Maybe you guys could invest in it for forearm splints. I think it's like $100, but if you're gonna use it forever, that's really good at rolling out the forearm. Better than just using your hand, and definitely better than using a foam roll.
What's that called?
Arm aid, yeah. It's like a blue device, and you grab the top and you pinch it together, and you can run your arm through it. Basically gets both sides at the same time. So that's that would be a pretty useful tool, because then you can just pass it around the gym. So that, I would say it's got to be more of the stretching. Definitely more of the stretching. What I'll find too though is, depending on the forearm splints, if it's on the inside, if you run along your pinky side of the bone here, there's your carpi ulnaris, and that thing gets super tight. That one usually causes a lot of pain. So, because you know, you're going to think more forearm, like the muscle median part in front, but he's kind of hidden just along the inside of the bone here. And once again, with that arm aid, they'd be able to find it and kind of be like, yeah, that part sucks really bad. So they need to work that out. The other thing I like doing with soft tissue too though, is movement while holding. So it's not just holding up and down. You're gonna find the worst spot and then have them extend through that like 10 times. That's gonna be probably, it's more aggressive, which means it yields better results. So as long as they're willing to go through that pain, they'll feel better faster.
It's more of a coaching selfish question.
Oh yeah.
You know, once I start coaching and I'm doing all my lifting, I mean, my shoulders are captured for the first week. What are the things that you suggest to make sure that I can prolong my life as a coach?
Interesting. Yeah. He said hire someone younger. You're best in that. It's not. I mean, I think what it comes down to sometimes, especially with coaching and doing stuff, is sometimes you overdo it because you're so excited and you want to help, but then you realize that they can get up by themselves. Like, you grab the mat and drag it. Like, I'm not getting you your mat anymore because you guys are the ones doing it. And I've done that for 15 years. Like, it might seem mean, but in the long run, it's like, yeah, you can get your own mat. Like, I don't have to go over there and get it for you. You're old enough.
Something that helps me, like, I work out a lot, it kind of helps me like resistance bands. So before you start to work out, before you start resistance, grab your resistance band, pull up and down, spread it out. Cut your bound help your gymnast, like, let it help me. So that kind of helps me out, and like, I stop getting shoulder pain, like when I start using more resistance bands, I'm lifting more weights. Right back.
All right.
Plantar fasciitis. A lot of our guys, because of all the constant pounding of, you know, with plyometric work and tumbling and falling, they get plantar fasciitis. I mean, recommendations there because athletes with that.
You know, most of my plantar fasciitis that I end up seeing, I usually find something wrong with their foot. So maybe their big toe doesn't move, maybe their navicular's not moving, maybe their subtalar joint's not moving. Typically, most Americans have terrible dorsiflexion, you know, so I would look, it would be more specific to each person, but maybe I would look at their dorsiflexion. Like if you even have them just do a deep squat, how far can they go before their heels come up? Because that might be an underlying factor of as easy as calf tightness, because if you think of any time that they pass that plane, they're going to put more force through the forefoot or their plantar fascia. Because like I said, with gymnastics, there's only so much you can do, and also it might come down to overload because they're not used to it. And I mean, I'll tell you this: when I did gymnastics, I had no plantar fascia pain, and whenever I did PT school for 3 years and worked for another 2, like so 5 years out, and I'm wearing shoes all the time, I actually started getting some foot pain. So I have a feeling like if you have someone from high school who's been wearing shoes all their life, and now you take it away, I don't know, they rely on that. So I'm not sure if that's an easy answer, but some of it might be just getting their foot used to not being babied as much. Does that kind of make sense? But I would say as simple as looking at their ankle dorsiflexion and see like, all right, you gotta work on this. So you either gotta stretch a calf and you gotta like soft tissue it, because if you don't have that mobility, you're definitely forcing more force either through their knee or their forefoot or their plantar fascia. So they're either gonna get knee pain or plantar fascia or just foot pain.
Anything to strengthen the wrists?
Yeah. I think I got a video. These are some of the ones that I liked. Let's see here. So a bucket is always really good. I'll do 30 seconds one way. This one I'll do squeezes, 30 seconds the other way. These guys working a stick, you can put weight at the end, trying to maintain just straight horizontal. I'll do 10 one way, 10 the other. It's good for mobility too. We'll do all 4 directions. You can do all 4 directions, Ulmer, and then you can also do radial. He doesn't do it. This one's really good for wrist extension. So you put like a 5-8 pound weight just on the stick with the rope. Keep the arm straight. He comes down, he doesn't rest. He's got to come straight back up, and your forearms will be burning. The key is don't let their elbows bend. If they're going like this, it's wrong. If their shoulders are high, it's wrong, right? You want their shoulders engaged and low. Some fingertip raises. So notice how he's on his knees. That's a progression. Eventually you could do it to where you're in a push-up position. Now most of your gymnasts probably don't need to be there. Just even wrist, for his issue itself, it was more of like wrist flexor tendonitis. This one, so he's on basically it's slopey, it works on false grip. So like on rings for false grip, it's definitely a different type of muscle. So then we were doing swings with it, and now we're also doing just one arm hangs, and then we went into shoulder strengthening, because a lot of times if your wrists are hurting, it could be from working out a ton, but it also could be from the fact that your shoulders aren't quite strong enough. So it kind of comes back to that whole, work the shoulders, like don't just do wrist strengthening for your wrist pain. There's more that you guys can do. So finding, positions that aren't painful and doing them. So he had a problem with horse. So then these are all progressions that I ended up doing with him. And I think in like probably 3 weeks he was pain free. And then we got him back to doing horse. And so with this, I was playing with different grips, because I want to say, yeah, that forward grip was painful. So then this is like his introduction to this type of stuff. We tried it earlier, it was painful. Tried it later, it was not. Tried different positions and positioning for a horse. So he's weight shifting, loading, and you can even tell, like with all this stuff, it's more than just the wrist that's working here. So, and we got him in the bucket, and then eventually got him doing circles. So, yeah, kind of just a full-length progression. And I started that mostly all just with basic strengthening, and then I started trying to apply the gymnastics side of it. Any other questions?
Updates and interpretations from Frank, as well
All right, so there's some JO updates, and I'll go over those, and those are essentially interpretations and clarifications, so those will go in our document that's on the website, but the things that were discussed here that are rules in the book, you know, the book is going to be modified and updated, so you'll know from us once that gets taken care of. But these things in here. So the freshman pommel horse sequence will have to be updated to removing flares and replacing with a more. The leg circle, travel and single leg circle, well, that'll go in the list of 8 skills. There will be no change on the high bar bonus. The rule about the 8/10 or less in deductions is going to stay in there, but it'll just be updated to show that you have to have 6 to 8 skills included with all element groups being met. Okay? All the bonus, all the JO bonus that we added last year will be removed from the book. And then these 2 additional rules will be added: 1/10 bonus for circling fig skills that include 180 turn, and then any fig skill done to handstand for credit on still rings gets a 1/10 bonus. So obviously, I know Eric just read all those, but those are the things that are going to be added directly to our rule book. All right, and then these other things are interpretations. All right, any questions on any of the new rules that were just voted on?
The swing and handstand bonus, is it repeatable? So if you do a press, you get a 1/10 bonus, and if you do a swing and handstand, you get a 1/10 bonus?
I mean, it says any fig skill done to handstand for credit, so you could do an A press on rings, presumably, that's a fig skill, and get a 1/10 bonus. You could do a swing to hand and get a 1/10 bonus.
So yeah, anything that was a center knocks gets a 1/10 bonus?
That's any fig skill done to handstand. I mean, we'd have to get an interpretation, but I mean, that'll, I'm guessing, have to be interpreted and brought to the rules committee to make a final determination on that. Is that a correct statement?
Frank, could we just bring back the old language of not, last year, but the previous year when we used to award a 10 for a stiff stick, like a straight arm press, a handstand, and a lock arm? So those would both get 10s because of a bent arm swing and handstand. I forgot his name.
It's not fig, but it's a JO exception that a bent arm shoot hand is a B.
So would that get 10? I don't know, that's something that we may want to just go back to the old rule.
Like I said, I mean, it'll have to be discussed, I guess, how the wording's going to go in, but this says any fig skill done to handstand for credit, so.
For the horse bonus with the 180 that we just voted in, we'll need an interpretation if that includes dismounts.
So is the question, will this apply to dismounts?
Yeah.
Okay. So we have to discuss that. So those will be discussed with the rules committee, and then that final language that's determined is what will go into the rule book. Any other questions on those? All right, so these are the updates that came out through JO, and so we'll just go event by event. All right, floor exercise, Japanese handstand position, okay, what officials are going to look for if you have a gymnast that's doing a Japanese press handstand is